oxygen therapy. Keep in mind, oxygen toxicity comes from patients highly likely that they have COPD that will stop their respiratory drive and cause oxygen toxicity. We're given too much for those COPD years of what they can handle. And then it's all based on how much, what the amount is, and how it's delivered. Okay? So those two combinations can cause oxygen toxicity. So with the hypoxia, low oxygen levels. So just some visuals. Venturi masks are based on percentages, non-rebreathers and partial non-rebreathers, all about the bag and plate. 100% non-rebreather is completely inflated non-rebreather, completely 100%, and then goes based on the liters. With the Venturi mask, it's based on liters, and then 10 liters of oxygen for that non-rebreather. Some people just roll it up even higher, but 10 is the goal. So it's 10 for every percentage. So you remember like that 1 liter is 10%, 2 liters is 2% when you put them on a Venturi mask or other mask as you go along. Keep in mind, with the nasal cannulas, oxygen is horribly drying. Horribly drying. So kind of the rule of thumb is 3 liters you put on humidified air, which means you get, a lot of times it's called a bubbler or the water, whatever, a humidifier. That's technically what it is. And so when you walk into a patient's room and you hear bubble, 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 bubble as you walk in, that means that they're probably on 3 liters or more, but of course you're gonna check the meter to find out for sure. Because it's horribly drying. So you wanna make sure how you can fix that dryness is putting some Vaseline, which is usually more like the Bacitrations. You don't want to use the KYs because it's got a more water base. But if you use some Bacitration and put it with a Q-tip around the nares, it will help with the moisture. If you've ever had oxygen in your nose for an extended period of time, you will appreciate that Bacitration. Okay? So you want to make sure that you lubricate inside too, not enough to close off their airway, of course, but you want to go ahead and coat around with a Q-tip. And the petroleum jelly based, like I said, the KYs have that watery little thing that comes out with it. T-pieces and trach collars. So trach collars is one of the easiest things. Patient has a trach, we put a trach collar on. Again, percentage based on liters. So if it's 1 liter of oxygen, it's 10% trach collar. Goes from there, okay? You notice, this says nebulizer. So in this animated picture, this should say humidifier because that's not a nebulizer. We know nebulizers as delivering bronchodilators. So it should say humidified air or humidifier or the bubbles. Now, with the trach collars, again, with that area, we want to make sure there is a humidifier on there because of how drying oxygen is. The T-piece is a little bit different. So patients who have mechanical ventilation and they're getting weaned off their ventilator based on what their ABGs showed, okay? When patients are on a vent, they get ABGs at least every morning. They might get it more often during the time of where they need it, but every morning once they're stable. The goal is to get them as close to normal ABG as we can, and then the physician will write for a T-piece. The problem with T-piece is we don't breathe through a straw, right? And so this makes it harder for them. So T-pieces are usually, okay, they're breathing good, let's pull it, and then we put a non-rebreather on them, 100%, okay? Or maybe they can tolerate a nasal cannula or a Venturi mask. Venturi Venti, same thing, mask.